In October, the One Health, One Caribbean, One Love project teamed up with the Health Ministry and the Ministry of Agriculture as part of a campaign to decrease vector-borne diseases in vulnerable areas. According to Chief Veterinary Officer Dr. King-Cenac, Ancillary has recorded an increase in vector-borne illnesses that include Zika, which is spread by a species of mosquito. Local area school, the Ancillary Primary School, was thus selected for the pilot project. Experts are seeking to deal with the problem by addressing the zoonotic link that is the spread of diseases from animals to humans. The first phase focuses on lessening outbreaks by finding resourceful uses for potential breeding spots like the old containers and the tires. This includes the planting of organic crops.
Concentrate on reducing breeding sites for vectors, meaning breeding sites for mosquitoes and so on. So all containers, tires and so on, that we could use it as a receptacle so that we could plant organic products so that we could eat and eat healthy. Phase 1 of the project was the greenhouse establishment. I'm sure you remember that there's a greenhouse at the back of your school, right? And some of you all participated in planting and reaping, harvesting some of what you all have planted from that project.
The Ministry of Agriculture is also working with fertilizer company Algas Organics to promote the use of environmentally friendly fertilizers and chemicals. The managing director says his company will donate the Algas Total Plant Tonic product to the school.
So you can move away from using so many chemicals and use more organic alternatives. Okay? The greenhouse to the back, this product would be donated to you guys, and you would see some amazing results at the back at your greenhouse, and you will know that you did not have to use all these heavy chemicals at the back there, and the food would be safe to eat and organic. So it is a pleasure to come on board. Algas is committed to community development and also providing organic inputs that are safe to use. You could use them around your pets, you could use them at home, and you don't have to worry about people getting poisoned or cancers.
School Representative Gregory Lawrence hopes the initiative will also have a positive impact on their food choices.
Talking about One Health, One Caribbean, One Love, it requires a certain amount of collaboration and cooperation. And students, you learn this as part of your social studies, as part of the society that you live in. St. Lucia is going to develop not just by one set of people, but by all of us. So this partnership is really to care about you, and so that you end up being citizens who are aware of good food, good diets, good lifestyles, and the way you can propagate these things in your community. So it's not a one-shot effort just today. It is something that they want to be continued.
The One Caribbean, One Health, and One Love project was implemented by the University of the West Indies, Pan American Health Organization, and the WHO with funding from the EU. The overarching goal is to increase food security and animal health and production in Caribbean territories. As a result, a One Health approach to zoonotic and foodborne disease surveillance, diagnosis, and response has been taken to achieve this goal. Joachim Duplessis, HDS News Force.